Welcome to the Concussion Fix podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynin Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
All right. Happy Thursday. Happy Q&A day, everybody. We also want to celebrate some wins. So a couple of wins recently. So I joined the program at 69 out of 132. And only a month later, she was down to 8. So we were chatting back and forth, and she, like, the words that she shared were just so heartfelt. And she had been struggling for a while. So to see it down to 8 in 1 month is absolutely amazing. And then who started the program at 44 out of 132 in 2 months was down to 3. So congratulations to both of those members.
You're going to kick us off. Thanks for breaking the ice.
Hi, can you hear me?
Yeah.
You can, yeah.
Hi. I just had a question. I put it on the discussion board yesterday. It was just kind of how to implement the program working full time, and with kind of little help and kind of having to do everything by yourself, grocery shopping, working full time. And yeah, basically that's it.
So you're working full time right now, you said?
So I actually start a new job as a registered nurse on Monday.
And what were you doing prior to that?
Working casually as an assistant in nursing, and medical receptionist.
Okay. And how was it when you were doing part-time?
Okay. I mean, my symptoms, I kind of have 24/7 brain fog, which I have for about 5 years now, which is the main problem. And it doesn't really shift too much, like it's always there. That makes sense?
Yep. So work doesn't make your symptoms worse, is what you're saying?
Not really. I have noticed when the only times I've had gaps of no symptoms has been on like a nursing placements at the hospital, or at work.
Where you actually have no symptoms sometimes at work?
Yeah, so I've had like 3 times where I've had a gap of no symptoms for like an hour or 2.
Beautiful.
Yeah.
So if work is not provoking your symptoms or making them worse, then that's fine.
Mhm.
Okay. Now, brain fog can be due to a whole bunch of different things.
Yeah.
I did a live presentation on brain fog recently, like it's in the resources section. But essentially any cognitive problem, including brain fog, can be due to autonomic. It can be due to inflammation. It can be due to anxiety and depression. Which kind of fits if you think about having gaps in your symptoms when you're at work. You're kind of distracted from things, and all of a sudden you're like, hey, I'm not experiencing these anymore. Whereas when you're at home and doing nothing, you can kind of focus on it more. So the number one, like across all the research when it comes to concussion and like cognitive problems, the number one predictor of who's going to experience or describe cognitive symptoms, usually it's a correlation between high anxiety and high depression levels. So I would pay really close attention to Melinda's section
Mm-hmm.
when you go through it. And then I would also equally pay a lot of attention to Paul's section, especially when you talk about vagus nerve stimulation and autonomic balancing and diet and inflammation. So I think your question is also about balancing time.
Mm-hmm.
Yeah. So you want to move slowly through this anyway, right? So you could commit to like, you're going to watch 10 minutes worth of content every day. Like, does that
Yeah.
sound realistic and feasible for you?
Yeah, because I feel like I'm prioritizing this right now. So even on the train to work or going anywhere, I do have time to do the modules. It's more just kind of slowly implementing other things, like baby steps with grocery shopping or things that kind of overwhelm me. I find a bit tough just because I have to obviously do it fully each time, if that makes sense.
Yeah. Yeah, for sure. And I think that stuff is unavoidable, right? Like you have to get food,
Hmm.
you have to be able to
Yeah.
do that. But don't be in a rush to try and consume all the content. And I
Yeah.
think that's where a lot of people go wrong, is that they're just going to try
Hmm.
and like power through all this content and hope that somehow some of it, sticks through osmosis or whatever. But ultimately what you want to do is you want to like take one section, listen to the modules, internalize it, and then figure out, how can I implement this into my day? So let's
Yeah.
say it's like, mindfulness based practices or something like that. Well, you mentioned already that you're on a train and that you can consume content on the train. Well, why not
Hmm.
use that time to, work on some of the like the other the practices, you know what I mean?
Yeah.
Or after work, you get home, like spend some time, like, just grounding and decompressing. Um, like you just got to try and just find these little periods where you can just go, okay, I'm going to schedule that in and I'm just going to start doing it, because then the more you do it, it just becomes habit. And then once you
Yeah.
formed a habit, now it's easy, right? So don't try to tack on everything all at once. And that's a big mistake some people make, is that they go through the whole program, consume all the content, and then now there's like a million things they have to do. And how am I ever going to schedule this in? It just
Yeah.
becomes, you're like basically paralysis by analysis, right? So what you want to do instead is take, consume one little piece and say, okay, that's a really good idea. When can I schedule that piece in? And then you don't consume any more content. You just
Hmm.
focus for the next few weeks on going, okay, I'm going to schedule this and I'm going to do this while I'm on the train. And
Yeah.
then once it becomes part of your everyday, where you're doing that without even thinking about it, it's just what you do now. Now you're ready for the next section. Now you can go back into the content, consume a little bit more of that content, take those pieces and say, okay, I'm going to implement this. And then you do that for the next 2 weeks. You don't worry about the content. You don't do, but now you're building habits on each domain in a very gradual way. And then it's easily doable, whether you're working full time or not. Do you
Yeah.
know what I mean? So don't put pressure on yourself to try and whip through everything, because that doesn't work anyway. You want to really slow it down and be like one little chunk, spend the next few weeks just scheduling it in, implementing it until it becomes a habit. And then now you can add the next piece. And then it just
Yeah.
gradually changes how you go through your day to day. And the fact that work is not increasing your symptoms is fine. That means that you can continue along with that.
Yeah.
When work becomes a challenge, like if you were saying, okay, I'm going to full-time work starting next week, but when I was working part-time, it was a real big struggle for me. I would probably encourage you to pull back on that and do like a gradual introduction, but obviously that's difficult with a full-time, new job, especially. Um,
Hmm.
but the fact that work isn't increasing your symptoms, right? Like you just kind of have this 24/7 brain fog. All we have to do now is figure out what's driving it.
Yeah, because there's also another thing with the brain fog. There was also another gap where I tried no sugar, and it was, oh, what was it? It was about, I had about 3 hours of no brain fog, and it was after having no sugar at all for 4 days. And then I stuck with the no sugar, and then after 3 hours, it came back. Um, so I didn't know why that kind of stopped it, and then I kept with the no sugar, and it still continued. If that makes sense.
It could be a bunch of things, right? Like
Hmm.
it's no sugar may be a factor, it may not be a factor for you. So who knows? That might have
Yeah.
just been a random one-off good day, and it happened to be the time that you eliminated sugar. I mean, ultimately,
Yeah.
That sounds more like it, actually, because like I mean, for you
Mhm.
having no brain fog for 3 hours and you not eating sugar for you said a week.
4 days.
Mhm.
Yeah.
I mean, that's like the effect of something for doing something 4 days. It's not going to be transient in the metrics of hours. It
Yeah.
usually, it's like okay, my bloating went away after I cut out this food after 4 days. Also, did you start eating sugar again after you had that period of time, or will you continue to be sugar
Um,
free?
I waited, I think, a couple weeks of doing complete no sugar, but I just had a 3-hour gap, if that makes sense. So then I kept doing no sugar and the fog was back.
Yeah, it's probably unrelated to sugar
Mm.
based on what you just
Yeah.
described. Because that, like Cam said,
Okay.
I think that was probably like a random 3 hours that something else happened.
Yeah, I
So
think I correlated because I've only had like 3 windows with a couple hours in 5 years, so I thought, "Oh, that might be one thing," but probably not.
that's a very short window, right?
Yeah.
Like we're obviously looking for a couple days of feeling better, and like, did you do any sort
Mhm.
of therapy? Did you it can be related to a whole bunch of things.
Yeah.
As we've discussed, brain fog is so multifactorial, but there's a huge component when it comes to brain fog to things that are related to the mental health space. So
Mhm.
anxiety, depression, that kind of general, that general feeling. So cognitive dysfunction, and I would even say brain fog, especially if you've had this for such a long period of time. Go
Mhm.
through that presentation that Cam did and kind of think of it almost like a checklist. Like, what have you,
Yeah.
because you've had it for so long, there's got to be something that's driving this. And if you can't pinpoint it exactly, then maybe can you at least narrow it down or rule out things that are not playing a role?
Yeah.
I think that has to be the first priority. Have you ever done something like that? Have you done that kind of exercise as you've? And I know you're just new in the course, so
Mhm.
maybe it's unfair to even ask that yet, because so much of that you'll learn as you go through the course.
Mm. Yeah, well, it was hard because I found a neuroscientist slash physio that kind of looked at the more holistic approach, and we kind of ticked off different things, trying sugar, gluten-free diet,
Hmm.
different we tried quite a lot of visual things, and it felt like we just tried 100 things and none of it really stuck. Um, so I think it's a good plan to kind of have a step approach to kind of go through it systematically because it
Yeah.
was a bit all over the place.
Yeah. I think
Yeah.
that's the biggest problem that people have. Like, if you try to start like narrowing down things one at a time in a kind of haphazard way, nothing really sticks. So instead, because it's probably a combination of a whole bunch of things. And the way that this works is you kind of have to be doing everything simultaneously, because what you do in autonomics is going to help with your gut function, which is then going to help with your inflammation, which is then going to help with your sleep, which is then going to help with your mood. And it just keeps snowballing. So that's why this is set up in this stepwise way. So I would just say your best bet right now is just start at the start, implement things, consume just a tiny bit of content, and then spend time implementing those strategies. And then once that's part of your routine, then you move on to the next piece. Take that content, figure out how you're going to implement that, spend the next few weeks implementing that. It's part of your routine, it's part of your everyday, right? Rather than like, I'm going to eliminate sugar, then I'm going to eliminate gluten, then I'm going to add back sugar because I don't know if it's helping. And then now you're like, what the hell is going on? It's just confusion.
Yeah, I think I got a bit overwhelmed trying to figure out everything,
Yeah.
and nothing was really working. So I think the step
Yeah.
by step, hopefully,
This
will be good.
strategy is super effective, right? We see it all the time. Like Nikki was talking about the wins before we started this session. People coming in with years of symptoms, with high symptom scores that after a month or two are basically down to like normal, non-concussed levels. And so it does work. It's
Mhm.
just gradual implementation over time and not being in a rush and not getting distracted by every little shiny object. Just
Yeah.
one at a time, because things will start to snowball, right? Like, you go through the mental health piece, you're going to knock some down. Maybe you have longer and longer windows. Great. Okay, now you add the next piece. Now you have longer and longer window. Great. Now you add the next piece. Now it's like, oh my God, I'm going 3 or 4 days with feeling good. And then it just keeps
Mhm.
going, right? So just slow and gradual, right? We talk about like the tortoise versus the hare in this program, right?
Mhm.
The hare is like, oh, I'm going to try that. I'm going to run real quick and I feel really good. And then all of a sudden I crash. you don't want to do that. You want to just be slow, steady, methodical, because that's how you kind of win this race, because it just starts to ramp up, and then all of a sudden, all at once, symptoms really start to dissipate.
Yeah, I just
Yeah.
wanted to jump in there because it's, that's the hardest part of this whole thing, right? Is you come into the program, you have this really persistent symptom or really problematic symptom that you just want to make it go away, right? It's just really hard to live with some of these symptoms, particularly dizziness and brain fog and headaches and pain. And so, as much as we're inviting you to take it slow and steady, which absolutely is kind of the way to get through this. It might just be that, self-talk piece too of reminding yourself that it takes time and it's a process, and, giving yourself a little bit more of a window to figure this out, because anytime, and we see this all the time when somebody comes in new, it's like, oh, maybe this is what's going to have the answer to my dizziness, my pain, my brain fog, and they hope to find that like immediately, right away. And it may just be sort of that self-talk piece of, can I slow it down just the way Dr. Cam and Dr. Paul have said really well here, in order to give myself time to figure this out, right? Brain fog, like they said, has a million different underlying root causes. So it is going to take time. And sometimes if we can set our expectations around that and give yourself the time and space to move through the program, take that added stress off of having the symptom. You can even use some language like, oh, here it is again. This is my friend that I don't really like to have in my life. You can kind of personify your symptoms in a way to just kind of help, name it. Notice it's there without, trying to resist it and get rid of it right away. So the more you can kind of work with what's happening instead of against what's happening, things tend to move along quicker. So I know it's not sort of a one-stop answer, but as you move through the program, we really are on your side and hope that you can figure this piece out. And I feel pretty confident that you can. So let us know how it goes.
Perfect. Thank you so much. Thank you for your help.
You're welcome.
You're welcome.
Thank you.
You'll get there, slow and steady.
Thank you.
All right, next is
Thanks again for doing this. It's so helpful. I want to piggyback on pacing question. So like holding it together at work, but then you crash afterwards and your symptoms flare and dealing with all that. Like, how do we realistically pace when we have to get so much done, and with dealing with everything prior to being able to start doing some things, like everything kind of got pushed to the side and built up. So, the house is a disaster. You've got all this other stuff to try and catch up on. And now so I'm like 2.5 years post-concussion and still dealing with symptoms and whatnot. And now that I'm able to do a little bit more, I want to get these things done, obviously, right? But so struggling with that pacing part, and I guess coming to terms with that, you still can't do things even though you still really want to, and how to deal with those limitations. Does that make sense?
Yeah, so I think kind of what you're saying, just if I understand correctly, is like stuff is piled up while you've been kind of suffering, and now you're feeling better, and now it's like overwhelming the amount that's been piled up and you want to start tackling it. Is that correct?
Yeah, and then still having to do with the groceries and the kids and the daily stuff, the dishes, and if you are working, the little bits of work that you can do. Still trying to have a social life with that, recovery, life balance, and all that jazz. And just, pacing, I guess, realistic pacing.
Yeah. So the thing you kind of want to avoid is trying to like add too much too quickly, because then that'll just, right? You got to think about it like the concussion cliff analogy, where any stressor is going to just put more stress on the system. So as you start to feel better, people start taking on more, which then adds more stress to them. And then eventually, if they go too far, they break that, and that pushes them over the edge. And now they're kind of back to square one. They have to kind of rebuild again. So you want to be really cautious about that. Try not to add too much too quickly. But what you could do, for example, is make a list of all the things that need to be done that have been pushed on the back burner. And then maybe grab one of those things to say, okay, this week or for the next 2 weeks, I'm going to gradually chip away at this one piece that is a priority. Because now you're still maintaining your day-to-day. You're feeling a bit better. You're not trying to do everything all at once to try and get right back to where, you need to be. But here's a list of all the things that I've been letting slip. And I'm going to focus this week on trying to kind of chip away at this one piece. Right? And then, okay, that one's gone. Now what's the next item? I can do that for the next week or two, chip away at that gradually so that you're still allowing yourself, that kind of recovery time, and you're not just going to put too much stress on the system. That's kind of how I would recommend it. Like even for me, like running a couple companies, I have a list beside me here that's, an entire page long. Right. So I'm just like, okay, what can I do now? What's most important? Okay, I'm going to chip away at that for the next couple weeks. And okay, that one's done. I cross it off. I'm on to the next thing and I go. I still think that's kind of how you have to do it. And also like rely on, help. If you have a spouse or someone that can kind of tackle some of those things for you. I think that's good too. Does that make sense? Or is that answering your question or?
Yeah, a little bit. Yeah, the list thing is usually helpful, but it's the wanting, I guess the frustration, I guess it'd be more Belinda's piece, like how
Yeah.
to deal with the not being able to do what you want to, I guess, when you're used to being able to do whatever, whenever you want, for however long you wanted to, with no limitations, like, I should be able to do the dishes in one go in like 5 minutes, but it takes half an hour or an hour and a half because I have to take breaks or, that kind of thing.
Yeah, I think that's more around that managing expectations, which is really hard when, certain functioning declines while you're post-concussion until you're feeling better, that you have to modify and simplify. The irony of that is that the more you simplify and, work with yourself to modify the things you're doing and work within your current capacity, the more likely it is that you'll move forward quicker in your recovery. So it can be really hard to like simplify or look at doing things in a little bit of a different way to support your symptoms. But the more you work with yourself alongside the symptoms that are problematic for you, the more likely it is that there'll be less resistance. And less resistance means that there's going to be more energy and more capacity for recovery. So one of the things that I work a lot with in my practice is this resistance and how resistance adds to our suffering. So the more frustrated and the more angry we feel about things that are restricted for us right now, the more likely it is that we're going to suffer more. And we taught, this is woven in through recovery mindset as well as the nervous system regulation, with a lot of science backing it, the sense of how much the added stress we can place on ourselves can hinder our recovery. So you might think of it from that lens, right? As much as it's so hard to sort of do the dishes in 3 separate go arounds than, the way you might usually have done it, doing so and not feeling overwhelmed with the frustration and anger by it can actually sort of support you to have a more balanced and regulated nervous system that's going to recruit more energy for your recovery. Now, that being said, the other piece that I often work on in my practice is, validating that it's okay to feel angry and frustrated, that you have certain limitations and restrictions around the things you can do when you're used to just not having those limits. But that might be in moderation, right? So can I set a worry, one of the things I use a lot in my practice is called a worry timer. Can I set a worry timer where I have 15 minutes to just either be like super angry, worry, go through all my worried thoughts, all my anxious thoughts, all my depressive thoughts, let myself wallow in it and sit in it. But when that timer goes off, I'm going to stand up, take a deep breath, maybe go outside, get some fresh air, and I'm going to move forward with that sense of less resistance around what's happened to me and more around working within my capacity so that I can continue to recruit energy towards my recovery. So it's not that we want to say don't feel or don't be frustrated or don't, feel sad or grieve the losses you're going through right now. It's just that if they carry with us all day long, they're actually adding more stress to an already stressful situation.
There's really no like simple way around it. It's like you have to kind of like go through this frustrating process. And I think this is probably one of the core things I see with my concussion patients that often is like the linchpin of their case and their progress, where we want to be like we were. Like I hear this all the time where it's like, I want to get back to my old self. I want to get back to doing whatever I was doing before. And there's a shift, and this is again, I know this is so easy to say and very difficult to implement, but there's a shift I've noticed in my patients where they actually kind of lean into the fact that they can't do all those things, and they actually have to think about, not really living in this world of like, I'm right here right now and this is where I used to be, and there's this vacuum, this gap, and that gap is filled with frustration, where it's like, you know what, I'm here now, this is where I was before, but maybe I need to get back to maybe I need to, I'm going to use the word reinvent myself to create a new situation that I'm actually even better than I was. There's a lot of things that lead to a person's current symptoms when they actually look back and take a moment in a concussion recovery process where they realize I was just doing a lot of unhealthy things. I actually wasn't really taking care of myself in the ideal way. And that's that kind of silver lining that everyone that's gone through our course, we invariably hear it in a lot of the feedback, is that they're like, you know what, I never realized all the positive things that came out of this journey that I totally didn't realize I actually had to do. So I know that's easier said, and I feel your frustration. I don't want to invalidate that, but I just want to kind of share with you the people that have succeeded going through this. This is the approach they've taken.
Yeah, I absolutely think that's such a big piece of it, right? Is adapting to a new normal is hard, but sometimes our concussion and concussion symptoms can get blamed for a lot of things that we might have phased out of our life naturally over time, anyways, right? And so it is a bit of an evolution. It's just that something that causes suffering sort of started that
Yeah.
evolution. And that can be something that, people really sink their teeth into and say, this shouldn't have happened to me. There's no way that, I would have changed in these ways if it weren't for the concussion, but actually might have. You might have moved into doing things simpler. Of course, not in the ways you're describing right now, but like as far as, having to take a lot of breaks from doing the dishes, but more so this overall picture that we hear a lot about in the program is, wait a second, there was these things within my recovery that I realized I actually started making better choices for myself. I learned to set boundaries is a big one I hear, right? I learned to manage my stress better. I found a new way to, have to exercise consistently and eat a healthier diet and stay connected to fewer friends instead of trying to be friends with everyone, for example. There's so many different ways this can show up, but just a little bit of food for thought, right? You're not always going to be in this place where there's a lot of suffering. And in time, I know there's been a lot of members come to us to say, hey, you know what, I do see these sort of more beneficial pieces that have come from my concussion as I've recovered that have actually been helpful in just overall lifestyle, overall health,
Yeah.
which is kind of like that gift in having a setback in life, which most people hate that word for the beginning few years because it doesn't feel like a gift at the time, but it is something that can come as you gain wisdom through your recovery. So right now I know there's a lot of weight and heaviness, but with the program and the support here, I hope that you find some ways to help alleviate that. I think Nikki wanted to share something. I know she's personally been in these shoes before.
Yeah, and it had me thinking, when you were mentioning at the beginning, how to tackle it all. I just want to kind of share, as much as everything that Melinda especially was saying was absolutely amazing, but what really helped me was having that list, kind of that Dr. Marshall shared, but think of the things of what is actually necessary. What are like your top two things? What are non-negotiables that you need to do today, and have those at the top. The rest can be negotiable, that can be done the next day. Another thing is, what can you actually delegate? What's a want and what's a need, right? Kind of thinking, we often think about that with spending, but what is it around our house that actually needs to get done? And what do we want to have to get done? Because those are actually two different things when we step back and look at it. And certain things too I remember just seeing this one post when I was a new mom of run the dishwasher twice. And it was a picture of, you've got all the pots and pans that you think you always need to wash by hand, but load them in the dishwasher and run the dishwasher twice if it doesn't get it clean 100% the first time. Finding those little things throughout the day that just unload the amount of stuff that we have forgotten and put aside while we're recovering, and just very, very slowly start to tackle it, because it's another big overwhelm when we start to feel better and actually start to look around and see everything that we've had to neglect over the time. So delegate as much as you can and really see what's that want versus need. And one of my favorite sayings now is run the dishwasher twice. It's okay to do that.
All right, thanks.
All right, we can go to.
Yeah, hey, so I have a couple questions. There's a lot of discussion about or talk about the anxiety and depression and correlation with different things like the brain fog and whatnot. But how do we know whether this is something that is like a biochemical, some sort of change that happened as a result of the concussion versus something that is more in our control, like, so for example, I fell on my nose in the driveway. That's how I got it 3 months ago. But I just noticed that it's like my normal state just feels like I just feel more anxious and depressed than what my baseline was before. So I guess my question is, like, how do we know whether it's like some sort of, chemical type of change that might warrant having to take medications? And then the second question is, I still sort of try to power through like the way that I was. I mean, I still yeah, I'm still, I've returned to work pretty much full time. That does trigger a lot of my symptoms during the week, unfortunately. But I still do things like that I was doing before, with different responsibilities and driving here and going there and taking care of this on the side. And because I think there's just a part of me that even if like sometimes I don't have that, like I can feel my energy declining or I can feel sort of sluggish, like I get nervous or paranoid that, okay, if I stop, like, I'll go into that state of where I'm gonna, get tired all the time, and it's just gonna get worse, and then I'm not gonna be able to function. Like, that's where my head goes, right? And so, if you do that kind of thing, like sometimes I work through the symptoms. Like if I have it and I just keep going, I kind of feel better and I work through it. Sometimes I don't. I get a flare up. So I just was wondering, like for my second question, in the long run, is it more of an impediment if I just keep trying to power through things, regardless of whether, I continue to have my symptoms or they flare up or not? Is it worse in the long run in terms of my kind of overall recovery?
It's a great question.
Yeah. So the first question, how do we know it's not some like, biochemical situation that's happening where we might need medication? The answer is we don't. We don't know. Now, obviously your observation of like your baseline anxiety levels are higher and all this stuff, that's a normal PCS thing, right? If we look at the data on like large population-based studies, your risk of being diagnosed with a mental health condition within 3 years of a concussion injury is anywhere from 50% to 200% higher after a concussion than it is after any other type of injury. So if you like broke your leg, for example, your risk of having, being diagnosed with some sort of, mental health condition like anxiety or depression within 3 years compared to somebody with a concussion is 50% to 200% higher, depending on the study you look at. And I think it's probably even worse if you're experiencing persistent symptoms, because then it just adds to that increased, anxiety of like, why do I still feel like this? And, your body will go into a state of fight or flight if things don't feel quite right. And that's going to increase anxiety. So is that biochemical? Like, it's not from necessarily the concussion injury itself per se, but remember, concussion is a stressor on the system. Just like a viral infection can be, right? People end up with long COVID and other situations like that. These types of stressors on your system can dysregulate a whole bunch of things. And that in turn could result in some, chemical responses. Can we change our brain chemistry by changing how we think? And I think we probably can, right? Like if you think of, happy thoughts. I'm reading this book right now on, it's actually on neuro-linguistic programming, which is kind of a cool, it's more in the psych world of Melinda here. But in that, they were trying to get you to do different exercises, right? Like just thinking, trying to visualize and use different senses. So like visualize a happy place, a time that you felt really happy and, whatever. And then you start thinking about the sounds that you experience, whatever. And if you go into that visualization, your whole mood actually elevates, right? Because what are you doing? Well, we're increasing like feel good signaling in our brain. And that can change the chemistry. So is this something we need medication for? We're not sure. The way that we kind of think about medication is we use that as more of a last resort. Because if we can actually do this without the medication, then we don't end up with all the side effects and negative things that can come with medication. So we try first to tackle all the underlying things, right? And so I just have, this is from the presentation I did. So if I can just share my screen here. Like this is the crazy web of cognition that I did in the brain fog presentation, but it's like you get a concussion that causes increased anxiety. It also causes autonomic dysregulation. Autonomic dysregulation can cause issues with blood flow to the brain, right? Which will affect cognitive function. It can cause issues with our gut. We know it can cause sleep issues, and it can cause all sorts of other symptoms and sensitivities. It can cause neck dysfunction, and then those, over time, these can lead to hormone dysfunctions and inflammation. And then all of this can lead to worsening cognitive function, which then starts to increase our anxiety, which then makes more autonomic dysregulation. And so the cycle just continues, right? So how do we break the cycle? Well, we work on helping with the anxiety, right, through the things that Melinda talks about. We also work on balancing our autonomic through things like vagus nerve stimulation and a whole bunch of other things. We work on addressing our sleep. We work on addressing our gut and our diet. And eventually you start to just kind of chip away at these things. And, will you eventually need medication? Maybe not. Or maybe you've done all these things and you're just not getting there. And then maybe a short course of medication is the way to go for you to kind of help break that cycle. And you know what I mean? So how do we know if you need medication? We don't. But we would rather treat and fix and help you to fix. You're going to get a much longer lasting effect if you can figure out your own strategies for how to address this and tackle it internally versus relying on a pharmaceutical to do that for you. But I have seen tons and tons of patients that all of a sudden they go on an antidepressant and all their symptoms go away. Right? So medication can be very powerful, but it wouldn't be my first line of defense. I would probably try all these other things first. And if you're still struggling, then maybe it's a consideration. I don't know, Melinda, if you have anything else to add on that side before I go on to the next question.
Yeah, it's a tough one. I mean, does any of that resonate so far? Some of, oftentimes what we get here are there's a lot of subjectivity to everybody's story, and we don't, answering your question here, unfortunately, we don't get to know all the subtleties of like what could specifically be helpful. I agree with what Dr. Cam said. But is there anything maybe more specific that you'd want to share with us?
No, I mean, it's, I get that diagram is really good. I would like to see that diagram. But when I'm looking at all this stuff, like it feels sometimes overwhelming. Like the way my life is, and probably so many people's lives are, like I have a lot of stuff on my plate, just like other people do. And so for me, I feel like it's hard to pace myself or to take 10 steps back so I'm going to have sleep issues because of the stress. I'm going to have, you know what I mean? Another day I'm going to I'm going to eat something and because I have LPR, that laryngeal reflux, right? And I get acute reflux that developed after long COVID 5 years ago. So that's also flared up, right? So sometimes like eating just even I took fish oil for 3 days. I took on the third day, that was it. Like it completely, I got chest tightness. I got like shortness of breath, everything, right? And so it's like, I can't, I feel like I can't manage every little thing. Like something's going to give, whether it's sleep or my diet, maybe the diet or, and so it just feels like, how do you control all these things to be able to know whether, okay, like I have now a steady state of no anxiety. You know what I mean? It's, or
Yeah,
like my workload, right? I mean, during the week, I mean, everything just flares up because I have a high cognitive based job, and like, so I just don't. That I think is where I feel sometimes a little hopeless and frustrated. Is like, I think I believe in what's happening, and I've had like when I work this program, and I've had great experiences when everything is going fine, and I'm doing all the stuff I need to do, but then life happens and responsibilities happen, and it just feels like how can you contain every little thing that's not going to like set off your autonomic or set off something inflammatory or whatever.
Yeah, I think
um
you just shared with us like that what that big underlying piece is, right? Is stress, right? Stress and working outside of your capacity. So when those two things are happening, then all the other little things can get disrupted as well. So while I'm hearing, sleep, diet, reflux are all things that are flaring up, the underlying reason for that is stress related to working outside of your capacity. So that share that you just, shared with us about your story is really helpful because that gives us some insight as to, what is the foundation here. So when we're chronically working outside of our capacity, then stress is going to be the number one thing that's going to disrupt our body systems and most likely kind of create these flare-ups and concussion. So sometimes it can, where you are, I'm hearing, there's nothing that you can negotiate and there's nothing that you can cut back on. But what I often invite clients to do is write a need to have and nice to have list. Sometimes there is actually things in there that you can cut back on, even with a busy, demanding schedule and a busy, demanding job. So you might think of the need to have as it's non-negotiable, right? I have to make food for my children, or I have to go to work because I need to, have the finances to for my family. But there may be those nice to haves, which I would describe more specifically as things that you can set on the shelf for now, right? Maybe there's a little bit too much of extracurriculars for the kids and you need to cut back on that so that you have more time to rest at home. Maybe there's ways that you can communicate at work that you need more breaks or that you need to take a step back in certain areas. Of course, I'm just throwing out examples that may or may not resonate for you. But the point being is that when we do this negotiable and non-negotiable list or the need to have, nice to have list, what we often learn is that there is a lot of things we're currently doing that are actually more in the nice to have or negotiable list than what we originally think. You've already shared with us that you kind of push through, and that's also a sign that you're working outside of your capacity. So I think that, to sort of support you overall right now, it might be worth evaluating how you're working outside your capacity and whether there is room to cut back on some of the things you're pushing through on right now. And starting there, because we know, and this is sort of the foundations of our program, is that the more we work outside of our capacity, the more likely it is our nervous system is going to be dysregulated, the potential for autonomic dysregulation, and the potential for a lot of these flare-ups and our concussion symptoms to return. So there's that piece to kind of think about whether it resonates or not. Looks like Cam has something to share here as well.
Yeah. So this is from the like planning and pacing module from the program, right? So we talk about there being kind of two types of maladaptive strategies. One of them is those who avoid symptoms, and then there's those who push through. Okay. So pushing through is not a good thing. And this is your second question, right? Is this harmful to me to just always be pushing through? Because sometimes I actually feel better when I push through, right? But what you're doing, right? And if you're avoiding, what happens is, like, let's say this is kind of your symptom line, right? This mild to moderate here. If you're avoiding symptoms, which a lot of people do, that's one bad strategy, is that line of symptom provocation starts getting closer and closer to you, where all of a sudden you get to a point where even doing anything provokes your symptoms because you've been avoiding for so long, right? So you get weaker over time, right? So the example here is like inactivity, right? Your muscles are going to gradually break down. You're going to get increased body fat. You're going to have poor cardiovascular fitness. And all these things are going to start to happen where even small stressors on your body are bad. Like it increase your symptoms. But then you have the pushing through, right? This is your symptom line. If you're banging into this wall every single week because you're going to work full time and you're trying to burn the candle at both ends, that's going to catch up with you and you're going to end up getting kind of punched back down. And the same thing happens is that your threshold for what you can tolerate actually gets lower and lower the more you try to push through. And we see this in things like exercise all the time too. People are like, I just try to push through, I try to push through, and all of a sudden, boom, big crash. And now I have to start all over again. So what you want to do is you want to find what that happy medium is. And it seems to be right now, if I could pick one thing, like work is really the thing that's keeping you at the level you're at. Work is what's preventing you from being able to actually get to the next level. And so I don't know what's possible in your particular unique situation, but when you go to work, right? Like let's say on Monday, do you notice that you're fine on Monday or do you start
Yeah.
experiencing symptoms at a certain point? So at what
Yeah.
point?
Well, Monday. So this is the cycle. Monday usually like by afternoon, I am fine, and then it's as the week progresses. So by Tuesday night, sleep is disrupted. But I had this even before, honestly. But and then Wednesday, Thursday, like it just ebbs and flows. Sometimes I get in a groove. I'm able to totally focus cognitively. I'm fine. Then some days it's just, it's too, like yesterday, I realized yesterday, like I was burning the can. I mean, I knew something was gonna give, because that was probably the busiest day since I got concussed in terms of just meetings and the cognitive load I took on. But so some days are good and some days are not good. But it's just by the end of the week, by Thursday or so, it's my symptoms are pretty whacked. And then Friday, I start to feel better. I think I go to the chiropractor or whatever, but I start to kind of feel better on Friday afternoon.
Right. And is that maybe the hope that the weekend is coming?
Maybe.
And, everyone's feeling good Friday afternoon?
Exactly. And probably, everybody at work is like, things are kind of a little more relaxed at work, I guess. And, whereas during the week, there's all kinds of demands and,
Yeah.
So yeah, that's probably part of it. I'm sure.
Now, is there a world in which you can work from home some days?
Yes. In fact, I just asked our HR to, if I can have, we're supposed to go in 3 days a week, but I asked if I could for 1 month just not go into work. So that's fine. And I just actually, before this call, I went ahead and just put an accommodation request to talk to somebody in HR just to see, like, because there's a reorg and, it could mean they're going to try to, they might try to put more responsibilities on me, and I'm just going to try to nip that in the bud too. Just basically at least ask for no more than what I'm doing now, or whatever it is I need. I don't know what I need accommodations wise, but I put a ticket in there, and at some point I will talk to somebody in HR about that. But I am working from home for 4 weeks.
How often, like before this, how often were you going to the office? Were you going in 5 days a week?
No, 3 days. The rule is 3 days. Yeah.
Okay.
Yeah. And I
Okay.
basically drop. So in the morning I get up and I get my son ready, drop him off at school. And then the whole process of driving and going to work is like, the whole process is 2 hours. I'm in the car most of the time. And,
Oh my God.
yeah. So I'm pretty sure that, that doesn't help matter. So I think, but the interesting thing is I'm still kind of flaring up a little bit, and this week might just be worse because of all this stuff yesterday and the reorgs and the anticipation around that. But yeah, so I have asked for 4 weeks of no going to work. And so they were, they gave me that, obviously. And then at some point, like, I'm probably going to ask for some accommodation. I just don't know what that is at this point.
Right. I mean, when you look at like how we kind of structure this, I don't know if you've gone through this module yet, but like,
no, I was looking, is this a Pacewood or what is that? No.
This is our return. This is the return to work module, right? So this is how we typically tell people that they should be starting to go back to work. So like you want to have like a day off in between, right? So like let's say you start Monday, Wednesday, Friday, and you just start. This is somebody coming in, like been off work for 6 months, and they're trying to get back into it. How do they do it? Well, we say just start like 2 hours a day, Monday, Wednesday, Friday, because that way you always get Tuesday and Thursday just off. You're not expected to be there. You're not expected to do anything. That's a recovery day. And then after a week or two, you move to you add 1 hour, but always just to the Monday, Wednesday, Friday. So you always get Tuesday and Thursday completely off as a recovery day. And then after a couple of weeks, now you add another hour to the Monday, Wednesday, Friday. And you gradually build yourself up to 8 hours a day just on Monday,
Yeah.
Wednesday, Friday. So you always get the Tuesday, Thursday off to recharge, to replenish, to get all the other life shit you have to get done. That's when you do it. Then once you hit that, then you start adding a couple hours on the Tuesday, Thursday. Then after a couple weeks, then you add another hour to the Tuesday, Thursday. And eventually you build yourself up to 8 hours. This is a gradual way of reintroducing work that allows you to build your tolerance, right? Think about it like training for a marathon, right? If a full work week is a marathon, you can't just jump into like full work week. You're just going to get crushed, right? If I tried to run a marathon right now, I'd be done. But if I said I want to run a marathon in 6 months' time, how could I train for that? Well, I start by running a couple kilometers, and then I start gradually increasing my mileage, and I do it so that I'm not overtraining, I'm not going to injure myself, and I'm going to be eventually able to hit that goal of where I want to get to. So your goal is obviously full-time work. Now, is there a world in which you could say, okay, for the next month, I'm going to work from home, but can I work Monday, Wednesday, Friday, have Tuesday, Thursdays off?
Like the whole day, Wednesday, Friday, or did this
Yeah.
2 hour? That's what you're saying. Okay.
No. Like I think you're at a point where I don't think you have to start at the very start, right? I think if you find somewhere in here, like let's say, okay, I'm going to work full days Monday, Wednesday, Friday, 8 hours a day, and I'm going to get my Tuesday, Thursday as recharge days, and I'm going to do that for a month.
Okay.
And then now you've kind of allowed yourself that space so that you're not banging into that wall every day, right? You have those rest days to recharge, replenish, and then you can hit it again on Wednesday. And then you can recharge, replenish, hit it again on Friday. Then you get the weekend to recharge, replenish, and then you hit it again on Monday. After you do that for a bit, I think your stress levels come down quite a bit, which allows you to sleep better and then allows you to actually get a handle on some of these other things because everything's connected. So it's the stress is going to impact the sleep is going to impact the inflammation and the gut and everything else, and it's just that's going to make you more anxious, and that's going to increase your autonomic, and that's going to increase the stress, and then here's the snowball. So what can we do to try and just reduce the stress to allow these systems to start, firing again? And then after a month, maybe you say, okay, I'm gonna work half days. Maybe you go 8 hours. I'm gonna work half days Tuesday, Thursday, so I still get that afternoon to just chill, and then build up from there. I don't know. That's to me, if you were looking for an accommodation, if you could just say, look, can I work from home, but Monday, Wednesday, Friday, just to allow myself to, get on top of this.
Yeah, and then take off Tuesday and Thursday. Yeah, I mean, I've seen this before, and I mean, at least it's good to know that I don't have to start from the beginning because it's
No.
just my. I mean, I've got a high deadline coming up. Like it's, I've got a certain set of expectations on me, and I'm just tend to be a high achiever, unfortunately. And then I've got this deadline. I mean, I've got this project, and I'm in the weeds of it, and I just feel like I can't. It's just hard for me to back away, but I guess I do need to really consider this.
What's really interesting, and I know that Melinda and Paul can both attest to this, is that the type A high achiever, super intelligent people, it's concussion recovery is hard for them because they're not used to chilling out.
Yeah.
Right? And you're in that camp. So you have to try and like put some guardrails on it. And it's not forever, right? Like that's the thing.
Yeah.
It's not forever. This is just a temporary thing to allow you to get a handle on shit so that you can be more productive in the future. But this like burning the candles at both ends, this high stress situation, you're just basically stuck in this like, boom bust cycle of like, okay, I'm going to go. And then boom, I'm done. And now I have to like reset all over again. And like, you can't get up,
Yeah.
It's a gift if you can have an employer who can work with you productively, right? I work with a lot of clients who don't have this option to sort of work from home or be able to, navigate that. So, maybe seeing that as a huge benefit to
I am lucky, and then at the same
modify.
time, I get scared because I am like I have a really good reputation, and so if I start backing away and not giving my all, it's part of it is just that fear again, right? Of what are people going to think, or what's how can I sort of like show this other side, and but yeah, I think I do need to probably do that.
Yeah, absolutely. And there's a lot of people in the chat that are agreeing with that mentality and, really understanding it. But hopefully, there's a few things in what we said that might be supportive for you.
Very helpful. Thank you.
So there's really only one question in the comment, and I think you've kind of described it all. It very much ties into what you were just talking about, Dr. Marshall. So the person had a 13-week plan to go back to work. They started the plan for 2 hours a day for 2 weeks and increased by an hour every 2 weeks. And then right before Christmas, they were actually up to 5 hours a day. But over Christmas break, super stressful, and went back to work, and they could only do 2 to 3 hours a day. And they've been trying to rebuild back up to that 3 to 4 even, but are very much struggling and just wondering how to push forward and get back up and continue getting to that 8 hours back to normal work day. So I think you kind of just went over a lot of that actually, but maybe if you had.
Yeah, I think that the thing that I found works the best is having that rest day. So if you're doing like a few hours, but it's every single day, you don't get that like recharge, replenish day in the middle. And I think that's important, especially when you're first starting. So, again, this comes down to how willing your employer is to work with you on this. But I think that if you were to say, okay, you're doing like, let's say 2 or 3 hours a day right now, but you're doing it 5 days a week. If you were to cut the Tuesday, Thursday and do the 2 to 3 hours, I think within a week or two, you'd be able to start getting to 4 and 5 hours a day on the Monday, Wednesday, Friday, knowing that you always have that break day on the Tuesday, Thursday. That might just allow you to kind of get a handle on it and get to that next level. But again, this all comes down to how willing your employer is to allow that to happen.
Yeah. I think that's a great spot to wrap it up for today. So thank you to all of the great questions in the chat and the support in the chat and the great questions for today. Have a great day, everyone. Bye.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.